Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you have wrist tendinitis, then you might have symptoms like hand pain, numbness, or tingling that might radiate up into your forearm when you're trying to work. But do you know what causes wrist tendinitis? It's actually an inflammation or swelling of the tendons in the forearm or the coverings of one or more tendons. The flexor tendons are like ropes, here shown in white, that connect the fingers to the flexor muscles, here shown in red, and working together they allow your fingers to flex. The inflammation and subsequent tendinitis are caused by overworking your hand. Wrist tendinitis can occur just about any time the hands are used extensively. Certain professions are more prone to wrist tendinitis, and not surprisingly, these professions require using the hand forcefully and repetitively. There are many high-risk professions, but particularly assembly line workers, hairdressers, carpenters, vibrating tool users, assembly line workers, carpenters, musicians, dental hygienists, ultrasonographers, and massage therapists are in the highest risk category. With such a high prevalence of wrist tendinitis, you might ask what can be done. Many people fall back to the old standard, which is taking painkillers to treat their pain and other symptoms. But this isn't the answer. The real, effective, and permanent answer is actually surprisingly simple. It's to rest your hand, splint at night so you don't bend your hand, and use deep tissue massage therapy on your wrist and forearm. The first one, rest, means just that. It means not doing anything with your hands to stress them or strain them during the day. It also means that you can't just put a splint on your wrist and then go about your activities that cause strain to your hand. Next, you should splint every night while you sleep, and only sparingly during the day when you're awake. Night splinting keeps your hand from bending and twisting, further aggravating your condition. Finally, get professional deep tissue massage of your wrist and forearm. In fact, deep tissue massage is nearly 100% effective in relieving symptoms of wrist tendinitis, but only if done daily and for 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions over the tendons to drain accumulated fluid inside the tendons and to break up adhesions around the tendons. This results in a decreased inflammation of the tendons and a reduction of the tendinitis pain. When you sit down with your doctor, make sure to bring up these issues. Your doctor will most likely advise you of the benefits of deep tissue massage on your wrist and forearm, because it's the only therapy that will allow you to say goodbye to dangerous medicines and useless splints and braces. Wouldn't it be great to not worry about losing your job because of your hand pain, or to enjoy your hobbies, or to enjoy your life again? Deep tissue massage is proven time and again to be nearly 100% effective. It's also non-toxic and has no side effects. Essentially, you have nothing to lose in trying it. To get professional deep tissue massage therapy to treat your wrist tendinitis, you don't have to visit a massage therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have wrist tendinitis, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works like a therapist's fingers, treating you for wrist tendinitis or carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms, and it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of wrist tendinitis, as well as carpal tunnel syndrome and repetitive strain injury. Visit the Carpal RX at carpalrx.com.